Today we will be discussing the topic of fetal alcohol syndrome. We will discuss the etiology, risk factors, common comorbidities, types of fetal alcohol syndrome, the signs and symptoms, precautions and contraindications, the general medical course of treatment, OT's role in the occupations affected, and a video clip of someone living with fetal alcohol syndrome. What is fetal alcohol syndrome? Fetal alcohol syndrome occurs when a mother drinks alcohol during pregnancy. This results in brain damage, defects, and developmental issues. The cause of this is when a mother consumes alcohol and it enters the fetus's bloodstream by crossing through the placenta. The fetus metabolizes the alcohol slower than adults, which causes much higher blood alcohol levels. This interferes with the delivery of oxygen and nutrition for the developing fetus. This results in permanent damage to tissues, organs, and the brain of the developing fetus. Alcohol use during pregnancy is the leading preventable cause of birth defects, developmental disabilities, and learning disabilities. 1 in 100 babies have fetal alcohol syndrome, which is nearly the same rate as autism. The age of onset is at birth, but signs and symptoms may be found throughout the initial months and years of life. The etiology is acquired, and risk factors include alcohol consumption during pregnancy. The more alcohol that is consumed, the more the risk, and there is no safe amount of alcohol to consume during pregnancy. It has been found by the Institute of Medicine that of all substance abuse, including cocaine, heroin, and marijuana, alcohol produces the most serious neurobehavioral effects on the developing fetus. Common comorbidities of fetal alcohol syndrome include ADHD, aggression, inappropriate social conduct, and breaking rules and laws. Conduct disorder, receptive language disorder, expressive language disorder, substance abuse disorder, mood disorders, major depressive disorder, generalized anxiety disorder, eating disorders, problem with staying in or completing school, problems with independent living and with employment, inappropriate sexual behaviors, early death by accident, homicide, or suicide, and chronic serious otitis media. Some important statistics to consider are that over 60% of people with fetal alcohol syndrome over the age of 12 have been charged with a crime, while 55% of people with an alcohol-related neurodevelopmental disorder will be confined to a prison, psychiatric institution, or drug and alcohol treatment center. And 95% of people with fetal alcohol syndrome also have a mental illness.
There are different types of fetal alcohol syndrome. There is fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, alcohol-related birth defects, and neurobehavioral disorder associated with prenatal alcohol exposure. Each of these vary in level of severity and can affect the child differently. In fetal alcohol syndrome, this is the most severe and most involved type, and it can result in fetal death. You could also see abnormal facial features, central nervous system issues, growth problems, trouble in school and behavioral issues, and also problems with learning, memory, hearing, vision, language, and attention. In alcohol-related neurodevelopmental disorder, you could see problems with school and behavior, and also intellectual disabilities. Alcohol-related birth defects can cause the child to have problems with the heart, kidney, bones, and or hearing. And lastly, in neurobehavioral disorder associated with prenatal alcohol exposure, you can see impaired thinking and memory, trouble planning or forgetfulness, behavioral problems, tantrums, mood issues, irritability, and difficulty with attention. You can also see trouble with ADLs, bathing and dressing, social participation and play, and to be diagnosed, the mother of the child must have consumed more than 13 alcoholic drinks per month of pregnancy or more than 2 alcoholic drinks in one sitting. it is important to keep in mind that signs of fetal alcohol syndrome doesn't always appear at birth. A doctor may be able to spot severe alcohol effects in the child at birth, but that depends on how severe the level of alcohol the mother consumed. You may see these other symptoms later on in life, such as the intellectual disabilities and problems resulting in the heart, kidneys, bones, and impaired thinking and trouble later on. Signs and symptoms. In children with fetal alcohol syndrome, you can see abnormal facial features: a smooth ridge between the nose and upper lip, small head size, short stature, low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, learning disabilities, speech and language delays, intellectual disability, low IQ, poor reasoning and judgment skills, sleep problems, vision or hearing problems, problems with the heart, kidneys, or bones. Precautions and contraindications. Since the child may exhibit behavioral issues, it is important to always create strong boundaries and adhere to them. Also, if a child with fetal alcohol syndrome has heart defects, always approach high-intensity cardiovascular activity with caution. Contraindications is to avoid self-harm triggers.
The general medical course of treatment. Early intervention, which would help with walking, talking, and social skills. The interdisciplinary team, which would include a special education teacher to provide special services in school to help with learning and behavioral issues, a speech-language pathologist, a PCP or specialist to help with medical care for health problems such as vision problems or heart abnormalities, a physical therapist, occupational therapists that can work on vocational and occupational life skills training, a psychologist who can provide counseling to benefit parents and the family in dealing with the child's behavioral problems. Medications involved with fetal alcohol syndrome. There are no specific medications for this disorder, but some medications that may be used for comorbidities such as high energy levels, depression, or inability to focus may include stimulants, antidepressants, neuroleptics, or anti-anxiety medication. The OT's role. There are many occupations that can be affected for someone living with fetal alcohol syndrome. Education. Participating in the educational environment may be difficult for a child with fetal alcohol syndrome due to possible hyperactivity, learning or memory delays, lower IQ, or speech and language delays. Social participation may be impacted. With a peer or friend, due to slightly abnormal head size or facial deformity, the child may struggle socially. Within the family setting, if the parents are unable to properly care for the child. Play can be impacted. If the child has motor deficits, this may inhibit his ability to interact properly with his environment, thus impacting his occupation of play. Work. Due to low body weight or health issues that may persist into adulthood, the client may be limited in what capacity or setting he can work. There are many types of treatments an OT can utilize, and this would all depend on the setting and the individual needs of the client. They may include, but are not limited to, social skills group, muscle strengthening exercises, compensatory memory strategies, or stress management techniques. Here are some videos that properly depict what life is like living with fetal alcohol syndrome. You will meet Natalie and her mom, Stephanie, and you will hear El and his mom's story of having a child with fetal alcohol syndrome.
I always judged people like me. Growing up, I thought a woman who drank while she was pregnant was just about the worst kind of monster there was. Hey, Nat, we have to stay away from the camera, okay? It's just going to look at you.
Natalie, what's it like to be you?
I'm 6. Are you ready?
I'm ready. Are you ready?
Yeah.
What do you want to tell everyone?
I want to tell dinosaurs.
All right, tell them about dinosaurs.
Because I like the long necks.
Before Natalie came into my life, I was a mess. and I was drinking on a daily basis, and she was born at 28 weeks, so about 3 months early.
What's the best thing about Natalie?
She's the best sister I've ever had.
I was planning on giving her up for adoption because I couldn't take care of myself, so I certainly couldn't be responsible for taking care of somebody else.
What's your favorite thing about dinosaurs?
The Tyrannosaurus Rex.
What does he say?
Since the day she was born, that idea was never spoken of within my family. Like, we never revisited that subject.
We feel like we're friends, not sisters. But we're sisters. And now we're sisters.
It was in the NICU for 3 months from when she was born, and so during the first month I went back to rehab.
If you could tell the whole world one thing, what would it be?
I'm a horse.
You're a horse?
Every day I'm grateful to be alive. She saved my life. And then her sister came along, and we just became a fun little family.
La 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 la. La 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 la. La 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 la. La 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 la.
We started seeing a lot of hyperactivity and emotionality. So we started getting a little concerned. When we first saw the developmental pediatrician, he suspected that there was an underlying syndrome due to fetal alcohol exposure. A diagnosis gives you some validation. We can say this is a disability that is a result of a birth defect. Living with a child with fetal alcohol syndrome is like living with the constant anticipation of a hurricane. Over time, you understand on so many different levels how this impacts not only your child, but your family. It's very hard to be a sibling of a child with fetal alcohol spectrum disorders. It's hard as a parent not to put this burden on your typical kid because it's like you want to say, you're the easy one. Don't act out. We know there is no magic bullet. There is no one thing that is going to change everything. Having some OT and speech and physical therapy certainly helped. And you want to try to teach social skills to your child. But I think the intervention that I am most excited about is that we obtained a service dog. Ayal has an unconditional companion. One of the things we've learned as parents is that you want to try to create external supports for your child so that they can feel successful in any environment possible. The earlier you have a diagnosis, you can start intervention. If you see some behaviors in your kids that might look like what I'm describing, you certainly would want to make sure that you have a pediatrician examine your child. And if you're not hearing things that feel intuitively like they're answering your questions or your concerns, that you go to some sort of specialist, either a child neurologist or a developmental pediatrician. You have to look at this in the face so that you can help your child. I think it's important to tell the truth, to talk about what this is, and not to be ashamed, because if you're going to teach your child to be an advocate for themselves, you have to say, this is my kid. Part of my kid is that he has a disability, a profound disability. Every parent wants their child to be happy, and certainly that's what we want for Ayal. I think finding happiness within the context of this disability is going to depend a lot on Ayal feeling safe. Because he's so vulnerable, it is going to be our lifelong job to keep him protected and safe. There are ports in the storm. You just have to look for them.